Great. So I'm Kelli Shallal. I am a local registered dietitian. I work with Jeff at Petersen Physical Therapy. I'll be telling you a little bit about what we're doing there and why a dietitian would want to work with a physical therapist. But if you can think of any reasons why a dietitian would team up with a physical therapist, it's inflammation, right? So you guys are here today because you want to learn about managing hip and knee pain through diet and exercise. And I am the diet part, right? And your diet has so much to do with the inflammation that you're experiencing, right? And so my job at Petersen Physical Therapy is to help support the treatment that his patients are receiving with diet, because we know that those are the best combinations to help reduce pain. So that's what I'm going to be talking a little bit about tonight. In addition to being a private practice RD, I also run a food and lifestyle blog. If you don't know what a blog is, it's just like a website that you post on a lot, okay? I share recipes, pictures of my dog and one-year-old baby on it, and lots of nutrition tips as well. And in addition to that, I am also an adjunct faculty member at Phoenix College. So that means that I am used to presenting every day, all the time, and I love participation just like any teacher, right? So if you've got questions, I want you to ask them. My understanding is that I have 15, 20 minutes for a presentation, about 10 minutes for questions after, but if you've got questions as I go along, I can moderate time. I'm happy to take them, okay? So with that, we'll get started. Let's see if this works. Okay. So apparently my slides are not branded, but that's okay. So you guys heard that diet affects your inflammation levels, right? Has anyone heard that? What have you heard? Just that it does? Any specific foods you've heard of? Foods that are inflammatory?
Sugar.
Sugar's one, okay. We'll talk about sugar. What else have you heard?
Hot sauce.
Hot sauce. That's a new one I haven't heard. Someone told you that's inflammatory? Interesting. Carbs, that's another one. What else have you heard? Well, this is a hot topic. How many times a day do you read something's inflammatory or read about inflammation? Caffeine. Ooh, that's a new one. I haven't heard that one. Okay. Someone's like, no, I don't believe it.
Farm-raised fish that's not wild caught.
Oh, okay. Interesting, right? So we're getting more and more off the beaten path, which I like because there are a lot of things. And so my job tonight is to clear up any confusion you might have with that, because I hear all kinds of crazy things, you guys. Like nothing you guys just mentioned is even crazy. But I hear things like, you ever heard like certain fruits or vegetables can be inflammatory? Yeah, that's weird, because they're full of anti-inflammatory compounds, right? So I'm going to clear up why you may have heard. What about gluten? You hear that one ever? Carbs, someone said carbs, right? So I'm going to talk about why you're hearing these things might be inflammatory and what you actually need to put into practice in your own life to make a real difference in pain levels. Sound good? All right. So sugar, let's talk about sugar first. So on the left, I have added sugars being inflammatory, and on the right, I have natural sugars being anti-inflammatory. So here's an interesting thing. You have, keep track of time here, you have three types of what we call macronutrients. You guys ever heard like carb, protein, and fat before? Right? So if I were to ask you to put vegetables, and not necessarily corn, but let's say like lettuce or broccoli, are they carb, protein, or fat?
Carbs.
They are carbs, but how many of you had to think about that for a second? Because what do we think of carbs normally as? Bread, pasta, sweet potatoes, all those things. And the sweet potatoes is probably not at the top of your list. I don't know. So actually, all fruits, vegetables, all plant matter is made up of carbohydrate. And carbohydrate breaks down into what? Sugar. So let's clear up a few things. Sugar, added sugar, is absolutely related to inflammation levels. I did a ton of research putting this presentation together to make sure that what I was saying was backed by sound research. And what I found is, yes, added sugar is related to inflammation markers, increasing inflammation markers in the body, which I'll go through in a second. But what's the difference between added sugar and sugar, sugar form? Nope, actually there's no difference. Anyone know?
Your body metabolizes them.
No, so your body doesn't really know a whole lot of difference between, like, say, sugar in an apple and added sugar. It's the amount. And it's the fact that what you're eating it in. So for instance, like sugar in, say, milk levels, milk has about 11 grams of naturally occurring sugar known as lactose. You know that really well if you cannot eat lactose, okay? But if you pick up, say, like a Greek yogurt from the grocery store and you're looking at all the different yogurts, right? You might see more than 11 grams of sugar in that yogurt, right? And that's because we do what? We add the sugar. So research shows time and time and time again that although like metabolically, and by that I mean the way we break down the sugar, does not change, our reaction, our inflammation levels, the inflammatory markers that we can measure, such as CRP, do increase with added sugar, but they do not increase when it's found in whole form. And that added sugar can be in something obvious like a juice or a can of soda, sports drinks. Those are all added sugars, right? It can be in something less obvious, like a healthy yogurt or ketchup, etc., right? So questions on that as far as the difference goes. Are we following me so far? I will ask for questions a lot because it's a teacher thing. Just gotta bear with me. So there is a difference, and what we found is that we see an increase in inflammation markers that your doctor would use to measure how much inflammation is in the body, such as CRP. We also see, even with excess added sugar in the diet, we see a increase in your bad cholesterol, your LDL cholesterol. We see an increase in something called AGE, which is when fat and sugar combine together and they oxidize and they cause stress in the body, and the body has to go around, and lots of antioxidants and phytochemicals have to clean up those chemicals, I guess. But it causes excess stress on the body, causing increased inflammation, and added sugars also lead to weight gain, which we know is a huge problem for inflammation. The more weight, particularly that you're carrying in your midsection, surrounding your organs, we call it visceral fat, the more inflammation you will have. So added sugars do become a problem there. But what I hate is when people say, well, I don't eat bananas because I heard they have too much sugar in them. Ever heard that before? I got a whole post in my blog on why that's not true. Okay? Fruit, vegetables, plant food in whole form will never increase your inflammation levels, ever. Okay? So please do not worry about sugar from fruit. Now, within our weight loss program at Petersen, we do teach very specific ways to manage blood sugar because that can be a factor in weight loss. And we do teach that, but I never tell someone not to eat a banana. I just say, let's eat some peanut butter with the banana so that your blood sugar is stabilized, okay? But I would much rather you eat the banana, keep picking on the banana, sorry, than say a soda or some chips from the vending machine or anything else that you think has less sugar in it but is not in whole form. So plant foods are extremely important at decreasing inflammation levels, and the sugar in those is not going to affect your inflammation levels. Make sense? Plant foods, like all these beautiful colored foods, reds, orange, yellows, they each come with their own set of antioxidants and phytochemicals. And those things decrease inflammation levels in the body. So the more, the better. You will hear a lot that like X fruit, X vegetable is so good for fighting inflammation. I want to tell you a little secret. They all do it. The more you can eat, the better. Each one comes with its own properties of anti-inflammatory properties, okay? Its own set of phytochemicals and antioxidants, very unique to that fruit and vegetable. So the more you have, the better, and the more variety, the better you're going to be able to fight that inflammation in the body. The less sugar cravings you have, which I have an entire presentation on sugar cravings that I can send you if you want to see it. It's an hour long. It's a real long thing. But the gist of it is eat more plant foods. Focus on what you need to eat more of, not how to just like stop eating sugar. You got to replace that with something. So, questions on that one before we move on? Yeah.
What about honey?
Oh, yes, thank you. So, natural sugar. So, again, added sugar can come in the form of cane sugar, honey, maple syrup. And the thing is I run a food blog, right? So do I use honey and maple syrup, etc., in my healthy paleo muffins or whatever I'm making? Yes, absolutely. But I minimize it, okay? Because if it's added to a food, it's still the same scenario. Added sugar is what is causing the increased inflammation levels, not the type of sugar. We do know there are slightly higher levels of inflammation with high fructose corn syrup compared to the rest of them, but I think a lot of us are already looking for that nowadays, right? That was a great question. I'm glad you clarified that. Anything else? Yeah?
What about sweeteners?
Artificial sweeteners. I did not look up specific research on artificial sweeteners, so I can't answer that directly, but I will. If you email me, I'll give you my card. I can look it up. My understanding, because I didn't look it up recently, but my understanding is that there has not been any correlation with that. Now, there are some issues with artificial sweeteners that we could go into, and I actually go into the course at Petersen. But as far as like inflammation levels go, my understanding is that there isn't a correlation there. I do believe stevia has been researched for lower levels of inflammation. Yeah?
How about things like deli meats, like honey ham?
We're getting there. Yeah. Are you talking about the sugar or the meat itself? The meat?
The sugar.
The sugar would be an added sugar, so it would increase risk. But we're going to talk about the meat. So let's move on, and I can always answer more questions about sugar later. Because the next thing we need to talk about is refined grains versus whole grains. How many of you have heard that grains are inflammatory? Oh, come on. Everybody, right? You haven't heard that? Yeah, you have. You just don't want to raise your hand. Gluten, come on. You ever seen gluten on a package, or someone told you they stopped eating gluten and all their pain went away? All right, so there's two things with this. One, refined grains has very similar research to added sugar, okay? The more you intake, the higher we see of inflammation levels in the body. Now, the more whole grains, the lower inflammation levels we see in the body. In fact, we see lower blood pressure, we see weight loss. It's because there's increased fiber and protein in a whole grain. The difference here, and the little caveat here, is that some people do have food sensitivities to certain grains. The amount of people that have this is in the minority compared to the people who think they have this, okay? But food sensitivities are real, they do exist, and some people do better without certain types of grains, okay? So that's the first time and probably the only time that I'm going to address unique food sensitivities within this presentation, because it doesn't happen all that much. But if you're concerned that it may be something you're experiencing, I'm happy to discuss with you. But in general, if you make the simple changes and the simple swaps that I'm talking about in this presentation, your inflammation levels should drop and you should see a decrease. With refined grains and added sugars, the other problem we see with excess intake of them is something we call increased gut permeability. Have you ever heard the term leaky gut? Okay, so that's real. The research has confirmed that this is a real thing, and it does what we call, you're supposed to have these little tight junctions in your GI tract that are supposed to keep everything from, going into your body that it shouldn't. In fact, I kind of think of the GI tract as an external organ, because think about all the external things that go through the GI tract. And when those junctions start to separate a little bit, we get what we call increased permeability, which makes the gut leaky, and that increases inflammation levels. So added sugars and refined grains are associated with an increased risk of that. Whole grains and whole fruits and vegetables, whole sources of sugar or carbohydrates, are associated with a reduced risk of that. Okay? So the USDA recommends make half your grains whole grains. I recommend you make them all whole grains except for your birthday cake, okay? Half isn't enough. Now, here's the thing. A whole grain, the only difference there, and I go over this all the time with people, so I know a lot of people don't know. The only difference, you know the difference between white rice and brown rice? Anyone know? It's not two different species. A lot of people think it is. It's not. All they do with white rice is they strip the brown outer layer, which has all the fiber, protein, and B vitamins.
Oh, but it's so good.
Depends. It depends. You can get used to the other one. It's chewy, nuttier, heartier. But that is true of almost all grains. So like your white bread versus your whole wheat bread. All they've done is strip the outer layers of that kernel and then processed it. And that is the big difference, right? So again, the more whole foods, the better. The less processing that's done, the better. Unfortunately, they do less processing and charge you more for it. I can't do anything about that. But that's the deal with whole grains and grains. Now, there's something else that's really important that I wanted to hit on for this presentation, and that is omega-6 oils versus omega-3 oils. Have you guys heard these terms before? Okay, so omega-6 oils and omega-3 oils are both somewhat considered heart healthy when you're swapping them for things like animal-based oils, like saturated fat-based things, okay? However, omega-6 oils are things like corn oil, and I always call them the S's, safflower, soy, sunflower oil. We are supposed to have, they're very inflammatory by nature, okay? Whereas omega-3 oils come from things like salmon, walnuts, chia seeds, pumpkin seeds, flax, all those buzzwords you've been hearing all over it. People keep telling you to put in your smoothie. You should do that, okay? So the reason is, so the thing is that they recommend that we have a 4-to-1 ratio of omega-6, which is inflammatory by nature, okay? It actually sends inflammatory messages throughout the body. And omega-3, which is anti-inflammatory and sends anti-inflammatory messages throughout the body. A 4-to-1 ratio is what's recommended. Can you guess what's normal? Like what the average person does? Oh, it's higher. It's probably 15 to 20 to 1. That's what the average person intakes of omega-6 to omega-3. Highly inflammatory diet, right? And that is easy to do even if you're eating healthy, because you're like reading the back of the labels, you're shopping at Sprouts, they've got sunflower oil there, that sounds healthy, right? It's not butter and lard and all these other things. It sounds good, but unfortunately, if your omega-6 to omega-3 ratio is off, it can make a significant difference in your inflammation levels, okay? So to combat that, olive oil is neutral, so that's a good choice. Avocados are neutral, so that's a good choice. And really focusing on bumping these other things up, like fatty fish, really, really important, like salmon, tuna, etc. Okay? And then plant-based sources like flax, chia, and walnuts. Now, you're going to have a better absorption level and more anti-inflammatory messages coming from the salmon and seafood-based sources than you will with the plant-based sources because of the way our body metabolizes it. But that doesn't mean just skip the plant-based sources. Still eat them. You're still getting the omega-3s, but just know if you consume fish, you really should be doing it 2 to 3 times a week for fish. Okay?
What about extra virgin olive oil?
Yeah, so extra virgin olive oil or any type of olive oil is more neutral. It doesn't fall into either of these categories. It's what we call a monounsaturated fat. And one of the reasons it's so healthy, in my opinion, is because it doesn't fall into the omega-6 category. But it's also not like a saturated fat that will raise your cholesterol levels, your inflammation levels. Very neutral, very heart healthy. Yeah.
What about coconut oil?
So coconut oil is a hard one because coconut oil is saturated fat based. And so the thing about that is we know saturated fat increases cholesterol levels, causes some negative effects on the body. But what we're finding is that saturated fat in of itself, there's more to the story than just your cholesterol levels. It can get really, really technical, and I don't want to go into all of that. But there's more than just your cholesterol levels. And we think that plant-based saturated fat may provide a little differently. I don't know what the research is particularly on inflammation with coconut oil, but what I typically recommend my clients do is use it sparingly, but not like, oh, I can't ever use it, but I just mean like use it in rotation and not like overdo it one way or the other. There was a time period where everyone was like, coconut oil is the best, and they were using it like every single day on everything, and guess what? It's still a saturated fat. It still raises some people's cholesterol, and if you're hyper responsive, so like you had high cholesterol at 20, so like you have a family history of that or something like that, you know, you need to be more careful. So I don't have like a good direct answer on that other than I tell my clients to use that every once in a while, maybe 2 to 3 times a week, and you're fine, and you're going to get some of the health benefits associated with it while avoiding some of the risk. So So alcohol is inflammatory. What I wanted to touch on for this particular slide, I know, alcohol versus water. I mean, like I could have put anything other in the other category, right? So, okay, here's the thing. I just went over this with my students today too. So here's the thing. Like we've heard that like wine is good for you, right? It has antioxidants, etc. Well, that's like saying I'm going to get all of my minerals from honey and maple syrup. Because those things have trace minerals and antioxidants in them, which is why they're better than regular sugar. But I don't want you to be getting the majority of your antioxidants from maple syrup, and I really don't want you to get the majority of your antioxidants from wine, okay? So, although it can decrease stress levels, there is some research to show that it decreases stress levels and it may reduce risk of certain heart-related things. The problem here is that it does increase inflammation levels. Even just one drink, okay? And that is one of the reasons why we've associated alcohol intake with things like certain types of cancers, right? We see it with increased AGE, increased CRP levels, increased markers in the body that measure inflammation. So you want to keep this to a minimum. Less is better when it comes to drinking, right? And then you also want to keep to the minimum the added sugar that you add in a drink. Right? So if you're drinking something like vodka, gin, etc., and then you're adding like a Coke on top of it, like that's double trouble, right? So stick with soda water or, I don't know, something similar to that, okay? Water, on the flip side, is anti-inflammatory. And I know I could have put like tea or coffee or anything else in the anti-inflammatory side that would have been a little bit more fun. But one of the first things that we have our weight loss participants do at Petersen is drink more water. Does anyone know how much? Do you know how much? Half your body weight in your fluid ounces, okay? So there are a few reasons for that, but one is because half your body weight should be water. 55 to 65 or even 70% of your body weight is composed of water. And in order to fight inflammation in your body, you have to provide the fluid in order for it to do so, because all those metabolic processes, all that healing, all of those things are happening in fluid, okay? Otherwise, it's got nowhere to go and nowhere to do it, okay? Just even slight dehydration can fatigue you, can slow down your metabolic processes and reduce healing and recovery time, which is why we have our clients at Petersen start with water, because it's one of the most effective things that you can do. So half your body weight in fluid ounces of water. All right, so to the meat question. So processed meats. So the World Health Organization has made very few statements about risk of cancer, health conditions in general. And when we're looking at that, we're looking at inflammation levels, and what we found is that processed meats in particular cause a problem. They increase inflammation levels. We also know that people who consume processed meats tend to weigh a little bit more than others, right, which is also inflammatory. Again, I said that weight around the midsection is inflammatory. Now, the thing is there are hierarchies here, like red meat and pork, processed red meat and pork being more inflammatory than, say, chicken, and this has to do with the compounds that are formed when these foods are processed. But on the flip side, someone asked about, you asked about the meat, right? The thing on the flip side is the research doesn't directly point to it, but we know fish is anti-inflammatory. We know more fish and beans as protein is anti-inflammatory. Where it gets controversial is the red meat and chicken, okay? Here's what I will tell you. The chicken's kind of neutral. Like, we don't have a lot of research either way. Like, the vegetarians will point to one study and everyone else points to another, and there's the whole thing. But I will tell you, quality of red meat does matter, okay? And I hate to say that because I know that 100% grass-fed meat is expensive, but it has more omega-3s, more antioxidants, and it's leaner naturally. It's expensive. So eat a little less. Eat some more produce. I know I'm not the most popular person. Like, don't drink, eat more produce, eat, $17 grass-fed meat. Like, yay, I'm super popular. But I would not stand up here and tell you these things if I did not truly believe that they would make a difference in your pain levels. I have had a back problem for 5 years, and I can tell you that I have a huge difference in my inflammation levels and my pain levels when I'm eating one way compared to another. Right, irregardless of weight. So I've been in those shoes and I understand. I think with that, there are a few other inflammatory properties I wanted to go through. So the more excess preservatives, chemicals, stress you put on your body having to process extra things out that aren't actually food, the more higher your inflammation levels will be. We talked about carrying excess weight. Unresolved nightshade issues. I talked about leaky gut. What's going on? Okay. I'm not touching it. You see, I'm not touching it. This is a mic. There are some controversies with nightshade, gluten, and dairy. Again, small percentage of the population, but you could be one. So here's what I have my clients do. If you have an issue, if you really think that those might be a problem, don't cut gluten out until you get a celiac test, because then once you cut it out, you can't test. So just get a celiac test, then you can try cutting out gluten if you want. It's not going to kill you, okay? Same thing with dairy. You think dairy is causing you problems? Cut it out. See how it goes. If you don't notice a difference. I never noticed a difference with dairy and my pain levels. It was fine. I've had clients who have had huge differences, okay? So those are two things I'm okay with people cutting out just to check it out and see. You may have heard that nightshade vegetables make an issue with pain. Nightshade vegetables are a family. I know, I'm sorry, I don't know what's going on. But they're a category of families that include solanine-rich vegetables like potatoes, eggplant, peppers, etc. You may have heard that those are inflammatory, but that is only if you are sensitive to them. So it's not like everybody that has arthritis has issues with those vegetables, okay? There are just people that are sensitive to them. Yeah?
How long would you have to trial something?
Oh, good question. I'd give it 2 to 4 weeks.
And then the other thing, how often do you have to drink this after your body weight?
Every day.
Huh?
Every day.
Every day.
Every day.
Peanut butter can moderate the effect of the sugar in a banana, and how does that work, and
I need about 30 more minutes to talk about that. But anytime you pair a carbohydrate with a protein or fat, it slows down the blood sugar spike, and that's the moderation effect. But I can direct you to a few blog posts if you shoot me an email, and we can talk about it.
But peanut butter does have added sugars, doesn't it?
Not always. You can get natural peanut butter. Yeah. I don't know how much
You
time I
said
have.
the amount of water, can you substitute sport drinks that are non-sugar?
Okay. Here's what I tell my clients. 1 drink. You can do that with 1 drink. You can have 1 cup of coffee and 1 unsweetened tea or something like that, and then the rest of it is water. And there's a lot of reason like that, because one would be the excess chemicals, Splenda, etc. Even if it's a non-sugar sports drink, you're still going to have to process those chemicals out, and that's harder on the body, and that could potentially increase your inflammation levels. Yeah?
Do you have to, can you give us the information about your blog so we can contact you? Or?
Oh yeah, I've got a card over there too, and you can always contact me through Petersen Physical Therapy as well. Yep. So a few foods that do fight inflammation: green tea, turmeric, and dark chocolate. Those are 3 things that you can add to your diet as soon as possible to help fight inflammation. I'm out of time to talk to you exactly about why, but those are 3 things that really work that you can add to your diet. Questions?
I have a question. Now, not all of Peterson's has someone to help you. Where are you at?
That's not true. So in fact, actually, I work with all of the Petersen Physical Therapy clinics.
Okay, the one I go to, they said they haven't had one for years.
Which one do you go to?
I don't want to get them in trouble.
That dirty rat?
Well, yeah.
We
What?
connect you with Kelli.
Yeah, absolutely. I work with all of the clinics, and we have an entire Facebook group where I connect with every single member, and I talk with my members one-on-one on WhatsApp as well. So yeah. Okay, I think I've stolen all the time. I'm not over. I'm 1 minute over. So if you have anything else, I'll be back there, and I'll be here the whole time to talk with you guys. So with that, I'm going to have Jeff come up next.